Hello, I'm Bob Davidson. Most Americans are aware of the declining state of healthcare in our nation. Costs continue to rise, coverage is often inadequate, and many of our seniors are being denied care. In fact, 47 million Americans have no health insurance. But if the healthcare crisis is mismanaged, these problems could be just the beginning. Our 8-week investigation revealed that some of the proposed solutions to the crisis could actually worsen the situation dramatically. Millions of Americans with pre-existing conditions are finding it increasingly difficult to obtain affordable health care. An independent report found that only 10% of individuals who look for health care on the open market are able to obtain an affordable plan.
A person with a pre-existing health condition may not be able to obtain health insurance.
People who are older, who have a existing or pre-existing medical condition, find it almost impossible to get insurance on the individual market, and that is creating enormous barriers for people to get help.
However, our investigation revealed that John McCain's plans to eliminate government protections on the healthcare industry will do nothing to remedy this serious situation. In fact, it may even encourage insurance companies to deny coverage to those who need it most.
Senator, you referred several times to pre-existing conditions, and obviously as a cancer survivor, you know how tough it is for people with such conditions to buy new insurance, how costly it is, how often they're just flat out denied. Why not level the playing field, prevent insurance companies from cherry picking, and let them compete on a level playing field?
Because I think then we would be mandating what the free enterprise system does. And that would be obviously something that I would not approve of.
John McCain also does not want to put any sort of regulations on the insurance companies that are selling that insurance. So that means that if you have a pre-existing condition, it'll be very, very difficult for you to find insurance because a health insurance company can decline writing a policy for you.
Under the McCain plan, you may not have any coverage at all. Health insurance companies might not have to cover you. There won't be anyone to make them.
I know people out there who don't have any insurance because they can't get anybody to cover them. McCain's plan, there's no cure for that. It's just more of the same.
Escalating health care costs have become a burden on many Americans. A recently conducted study found that health insurance premiums rose 78% from 2001 to 2007. But our research has shown that John McCain's plan would compound the problem by shifting even more costs onto individuals.
Really, one of the important aspects of this is to put more responsibility on the person who is insured. Right now, as you know, when it's paid for and taken care of, then people are not as responsible as they will be, and part of that is a higher copay, but it's also more of an investment on the part of the person who is the recipient.
The cost of health care is astronomical.
You have to decide if you're going to pay the electric company, the water company, the gas company, or get food, or get the medicine you're not getting at a clinic if you're getting it at all. My wife, and probably many people out there watching this, have been affected by the not affordable health costs. You just can't pay them.
My patients should not have to choose between whether or not they will take their medication for heart failure or eat 3 meals a day.
Maury Rosen, a retired radio announcer from Philadelphia, Pennsylvania, lost his wife to cancer in 1990 and continues to struggle with his own health care affordability issues.
With taking care of her being sick, I used all my savings. She used hers when her sons were sick. And after, even then, I was helping her with Blue Cross for my stepsons. I've never owed people before, and now I'm in debt. And most of it is paying for health insurance for my wife And me, sometimes when I've been sick, I don't want to call the ambulance. I don't want to go to the hospital.
The first question out of every receptionist's mouth is, what insurance do you have?
That McCain plan doesn't say I care enough about you to give you a nurse at your bedside or even access to walk into an emergency room. In fact, if you can't afford it, you can't have it. It's just not okay.
When somebody goes in the hospital, they should worry about getting well, not how they're going to pay for it.
Mike Friedman, a veteran of the U.S. Air Force from Toledo, Ohio, was recovering from a stroke when we sat down to talk with him.
My wife was up here the other night to the hospital, and she says, Mark, are we going to be able to afford all this? But why should that be an issue when you're trying to recover?
An estimated 160 million Americans receive employer-based health care coverage. Now, the Wall Street Journal reports that the McCain plan would eliminate the existing tax break for employers who provide their workers with coverage. If this becomes a reality, millions of Americans would be forced into inferior coverage, forced to pay more, or simply be denied coverage altogether.
If employer-based insurance were eliminated and individuals had to go out into the market and find their own insurance, it is quite likely that a significant number of people of all ages would find it extraordinarily difficult to find health insurance.
Senator McCain has proposed the elimination of the tax benefit that employers currently enjoy that encourages employers to provide employer-based health insurance.
Some people would find that the policies that were made available to them are just absolutely beyond their means in terms of expense.
Bill Luoma, a retired steelworker from Warren, Ohio, is a type 1 diabetic whose health care and prescription drug costs continue to grow every year.
When LTV Steel went out of business in Warren, we had people coming from Buffalo, New York, Chicago, Illinois, all over the state of Ohio, because we had insurance companies coming every day trying to sell insurance programs. They couldn't come up with affordable insurance that the average person who just lost their job would be able to afford.
My golly, if employer-based health care went away, I can't imagine what would happen.
They believe that we should privatize some of this, and I know how privatization works in this country. We know that from the phone companies. We privatized them and all our rates went up.
Our interviews and research were conclusive that Medicare is essential to the well-being of our nation's senior citizens. Most troubling to the doctors, nurses, and patients we talked to about this issue was John McCain's votes to cut nearly $250 billion from Medicare and Medicaid programs.
Now, I'm a guy that voted against the Medicare prescription drug bill.
I take 48 prescribed pills along with supplements. I'm on a pump because I'm a type 1 diabetic. It's $6,800 for the pump. For the reservoirs and the tubing, it's $450 every 3 months that I pay.
Medicare health insurance is a huge American success. It is the heart and soul of the American health care program for seniors and people with disabilities. Senator McCain has not been a strong advocate for Medicare. He has consistently supported programs that would reduce access to Medicare for seniors or underfund Medicare.
To our nation's veterans, health care has always been of the utmost importance.
Taking care of our military that are coming back. It's a big issue.
I started going to the VA hospital to pick up, have them do some of the medical care that I needed. And I can't say enough about the doctors and nurses there, because I know they're not making any of the money that the outside people are. But they're overworked.
We spoke to veterans and the doctors that care for them, and we were surprised to find that John McCain, a veteran himself, has voted against veterans' health interests over 20 times.
And I just would like to have a conversation with John McCain and say, How can you do that? When you were such a hero in the war, how come you couldn't be a hero now?
For older Americans, the importance of health care doesn't end with taking care of themselves. The well-being of their children and grandchildren is a foremost concern. John McCain's voting record, in particular his staunch opposition to the state children's health insurance program, could mean that future generations may face an even greater challenge when it comes to their health care.
It's so important to take the long-term view on health care.
I fear for my other children. I fear for my grandchildren. What are they going to do?
We have made tremendous strides in providing health insurance and then thus access to high-quality health care to children in this country through the establishment of the state children's health insurance program.
Another one he should veto is the S-chip program, which you should say take the C out of, because now it's for everybody, like every other entitlement program.
Funds that would have expanded the S-chip program, as it's called, were not approved. And John McCain was among those that didn't vote to expand the state children's health insurance program.
By making it harder to get health insurance and providing no relief for those burdened with ever-growing costs, John McCain's health care plan has left many experts concerned that it will make a bad situation even worse. If Americans want to improve the state of their health care system, voters of all ages should be aware of the facts when it's time to make a choice in November.
You know what? You're paying for my drugs. Do you know that? Don't you think I've voted enough pay raises for myself that I can pay for my own?
He should understand older people, that they're not in the Senate, they're not a representative, they're not president, and they don't have the health care that John McCain has.
So we need to elect a president and a Congress that supports American issues.
We need a president who advocates for programs that are fair and equitable for all of us.
Gosh, the treasures isn't in the knickknacks that you have on your wall or the size of your TV. It's the hug from your dad or the love you have from your child and the time you get to spend with them. And healthcare is so wrapped around that and imperative to that. And I can't imagine electing someone who isn't all about that every day.